Now I'll be discussing the transmission of coronavirus. So coronaviruses may be transmitted by contact with other infected individuals, hand-to-hand spreading of mucous membrane secretions, when a person coughs or sneezes, contact with surfaces that have mucous secretions from infected individuals. A lot of what is happening now with the transmission of COVID-19 is similar to the 2002 outbreak of SARS in China. SARS of 2002 was a result of the transfer of the virus from animals to humans because of dogs and cats that were raised for food. And I got this information from my textbook used in college, Medical Microbiology by P. Murray, K. Rosenthal and M Pfaller. And this is not an attack on any ethnic groups. I'm just talking about what I read. And so in 2012, the Middle East respiratory syndrome, CoV, was traced back to camels in Saudi Arabia. And presently in 2020, the COVID-19 is a new type of coronavirus that has never been identified in humans before. And this has been traced to animals in China. People with a weak immune system, like those who are already sick, as well as the elderly, they stand a higher chance of getting this virus. Diagnosis. The diagnosis of coronavirus is done by the following tests: the serum antibody test, test of respiratory and stool samples, RT-PCR, which means reverse transcription polymerase chain reaction, isolation of the coronavirus in cell culture, and electron microscopy. So that's basically how the medical technologists and clinical lab scientists test for coronavirus in the laboratory. They will then send the results to the physician, and then the physician would inform the patient of the results of the tests that were done. Now, treatment, prevention, and control. In order to get treatment if you have coronavirus, it's best to see a licensed healthcare provider. And scientists are presently working to develop a treatment for COVID-19. Treatment of the common cold is done by treating the common symptoms such as coughing, fever, and sneezing. Persons who have SARS-CoV, Middle East respiratory syndrome, or COVID-19 are placed under strict quarantine or asked to quarantine themselves. Now, coronavirus can be prevented by practicing good hygiene, which includes washing your hands, avoid touching your face, especially in public, taking a shower, washing your clothes, cleaning surfaces that are frequently touched like doorknobs. And presently in 2020, at the time that I'm making this video, people are being asked to practice social distancing to protect themselves and protect others by staying home and avoiding contact with other humans and live animals. So to recap, I discussed coronavirus under the headings classification, morphology, pathogenesis and clinical findings, laboratory diagnosis, treatment, prevention, and control. And as I said before, the best way to keep yourself healthy is to educate yourself about the disease and how you can prevent it. And I am going to list credible sources where you can gain information every day. And it's very important that you consult a licensed healthcare provider if you feel that you or your family member or someone that you know has coronavirus or display the symptoms of coronavirus. So thank you for watching my video, and I will see you in the next video.